My name is Shireen Rashid, and I am this year's Deputy Training Director. I will be providing you with some important training information as you prepare for the upcoming simulation. Created by the College of Nursing in 2008, Disaster Day is the nation's largest student-led interprofessional emergency response simulation. Past events have focused on mass casualties from hurricanes, tornadoes, explosions, and wildfires. These simulations bring interprofessional student teams together to diagnose, treat, and care for patients and populations. The next Disaster Day is scheduled for Friday, February 14th, 2020. This marks the event's 12th anniversary. Interprofessional Education has worked in collaboration with the Colleges of Medicine, Nursing, Pharmacy, Veterinary Medicine, and the School of Public Health to take Disaster Day to the next level. Originally, as Disaster Day started, the focus was on practicing clinical skills in an unfamiliar environment with unknown situations. Now, as Disaster Day has grown to include 5 different colleges, the Corps of Cadets, and continues to grow, we must make a point to shift our primary focus from solely clinical skills to helping students establish the skills needed to work on an interprofessional team. This year's participating colleges are the College of Medicine, the College of Nursing, the College of Pharmacy, the School of Public Health, Veterinary Medicine, and the Corps of Cadets acting as the National Guard. As mentioned previously, the focus of Disaster Day is to develop students' interprofessional skills. The focus is to cultivate core competencies listed on this slide: values and ethics, interprofessional communication, and roles and responsibilities of interprofessional practice. We will be simulating a real-life disaster and will expect all participants, both providers and patients, to maintain a climate of mutual respect and shared values. This means embracing cultural diversity and individual differences that define patients, populations, and a health team. We expect you to respect the roles and responsibilities and expertise of other health professions. The second competency is using the knowledge of one's own role and those of other professions to assess and address healthcare needs of patients. As a patient, expect acting providers to clearly communicate their roles and responsibilities to you. The third competency is interprofessional communication. This is crucial to making this event a success. As acting patients, expect providers to listen and use respectful language, especially as difficult situations arise throughout the simulation. Being a standardized patient is crucial to making the event a success. This short video will describe to you how crucial standardized patients are to the process of learning.
Standardized patient is essentially a healthy person who has been recruited from the community and trained to portray a patient, family member, or another integral portion of the patient.
Being a standardized patient is a very unique job. I get to portray different characters. I have been pregnant lady. I have been a new mom, a construction worker with a lung infection, and a brand new teenager, just to name a few.
I think that the standardized patient experience really is the unsung hero of medical education, because it's here in the SP encounters when we realize that we didn't really ask the questions that we needed to properly. And so we'll be sitting through a review session at the end, and you'll see all the little things that you missed throughout the history. That's really important for the doctor to know to make his diagnosis. And I think it's important that we learn that here in the classroom instead of out in the clinic. So I think that's really the big part of the SP experience.
The ability to see somebody grow, to give back to society, to allow the student to gain confidence and to grow in their role, and to give them feedback. You know, there's some things that they do well and some things that are areas for improvement. To do it improvement. And I used to be a college professor, and to work with students is truly a joy. You're shaping lives for tomorrow.
The very first time I had ever come in here, I was a little bit nervous. but the SPs also, the feedback that they give us. So each time that we come in here, not only is someone else watching us in the back and evaluating us, but the SPs themselves, once it's done, they get to evaluate us and give us their own personal feedback. We learn so much from the start of it to the very end. I can truly say that I've improved so much. I feel more confident going in with each encounter because I take what it is that they told me, the feedback they gave me, and I'm able to apply it and do better each time so that I can be the best when I actually go out in these real life patient encounters.
I just encourage people to get into it. It is really great. It allows the physicians of tomorrow to grow and mature, and you can see it in front of your eyes.
So what do we expect from you as a patient? We expect first and foremost that you show professionalism. Showing up on time to your shift and acting out your role appropriately is key. Each patient will receive a unique case prior to disaster day. It is crucial that you familiarize yourself with your role prior to simulation. We expect you to know your role before the day. You will not be given any case information on the day of the simulation. As a patient, you may be required for moulage done prior to the start of the simulation. Moulage is any makeup to indicate blood, bruises, or scabs. It's very important that you act your case out seriously as possible. This is an example of what a case will look like. This information is confidential and must not be shared with anyone else. We want to make this as realistic as possible. As I mentioned earlier, this sheet will indicate any kind of moulage you require. Assessment for each discipline, including nursing, medical, and pharmacy, will be also listed. Under each assessment, there are instructions on what you should say to each provider. For example, under medical assessment, if you have just taken pain medication, you may indicate your pain level has gone down from an 8 to a 3. Please act this out as realistically as possible. Not every case will have cards associated with it, but if yours does, this will be picked up at check-in on the day of the simulation. These cards will usually have a list of vitals on them that should only be given to providers after they've properly checked vitals. Please do not hand them over before then. So, what do we expect of you? We expect that you arrive on time for your assigned shift. There is a certain dress code, additionally, that is attached to Disaster City, and that is wearing long sleeve shirts, long pants, no leggings or yoga pants are allowed, and closed-toed shoes. If your case assignment indicates any other kind of clothing that contradicts this, for example, flip-flops or shorts, please disregard this. We expect you to stay off of your phone. So no photographs, selfies, or other inappropriate phone use. Again, we expect professionalism from you. As a general rule, we do not switch cases or your shift. We have over 600 participants, so we ask that you show up to your assigned time and take your role in Disaster Day seriously. If you do not show up to your assigned shift, you will be reported to your respective colleges, which may result in discipline-specific consequences. Do not offer hints to providers. To make things more realistic, we will be having simulated medication to indicate when a provider needs to prescribe medication. The provider will place the simulated medication in your hand to indicate that you've taken the dose. Please do not ingest the demo dose or even make a motion of ingesting it. Code Purple is a Texas A&M Health Science Center-wide code word for any real issue that occurs during the simulation. If you hear this from anyone around you, please find a faculty member or somebody in a maroon Disaster Day t-shirt and notify them of the situation immediately. The simulation will resume once the issue has been taken care of. There are a couple of things that you need to complete before you arrive on Disaster Day. There should have been a TEACS waiver form that should have been emailed to you. Please make sure to follow the instructions that are listed on this slide and fill out the waiver form and bring the completed copy to Disaster Day at check-in. You will check in with a Disaster Day Committee member set up at Fan Field. At this point, you will be given any patient case cards or vitals related to your case. This is where you will turn in your completed waiver form if you have not already done so. Then, Disaster Day members will direct you to the buses. This is a general outline of what your day will look like. So if you have been assigned to the AM shift, you will arrive at Fan Field at 7 a.m. with a completed waiver. You will check in, receive your case cards, and ride the bus to Disaster City. Once you have arrived at Disaster City, you will be directed to the moulage hut. After you've been moulaged, you will be directed to your specific station. Please keep in mind that not all of you will be directed to your assigned spot on the disaster site as soon as the simulation starts. So please make sure to follow the instructions of Disaster Day members at the site. After you've been moulaged, you will be directed to your station. The simulation is scheduled to begin promptly at 9 a.m. So if you have been discharged or have died in the simulation, you will be directed to a TEKS classroom. At this point, you can go ahead and take off your moulage to the moulage hut and then go to the TEKS classroom. At 11:45 a.m., the exercise will stop and participants will debrief. The simulation ends at 12 p.m. You will return to the moulage hut to be demoulaged if you haven't already done so. And then upon your return to Fan Field, you will receive your Disaster Day t-shirt. Please keep in mind, if you are finished with your responsibilities before the simulation ends, you will still have to wait at Disaster City until the simulation ends to be transported back to Fan Field. We do not have buses running during the simulation. For PM patients, you will arrive at Fan Field at 12 p.m. with a completed waiver. You will check in, receive your case, and ride the bus to Disaster City. Once you arrive at Disaster City, you will be directed to the moulage hut, where you will be moulaged and directed to your station. Once again, not all of you will be assigned immediately to your disaster site. Some of you may have to travel to your station after the simulation begins. The simulation itself is supposed to start at 2 p.m. Again, if you've been discharged or died, you can go ahead to the moulage hut to be demoulaged before you will be directed to a TEKS classroom. At 4:45, the exercise will stop and participants will debrief. The simulation ends at 5 p.m. You will return to the moulage hut to be demoulaged if you haven't already been done so. And then upon your return to Fan Field, you will receive your Disaster Day t-shirt. Again, for patients who have completed their responsibilities early, you will have to wait on site until the simulation ends before you can be transported back to Fan Field. So traveling to Disaster City, everyone must check in with Disaster Day committee members at Fan Field parking lot. In order to park at Fan Field, you must have a valid Texas A&M parking permit. Carpool, if you do not have a parking permit, make those arrangements in advance. So participants will travel by bus from Fan Field to Disaster City after checking in. And then the buses will transport you back to Fan Field after your shift is complete. If you are a remote participant, you will check in directly at Disaster City. This is a map of what Fan Field looks like. The yellow star is the entrance to Fan Field. This is the entrance that is located right across from the George Bush Library. You will go ahead and turn in that corner. There should be signage posted to help direct you to the site. You will park at Fan Field, and then you will be headed towards the Blue Cross, which is where check-in will happen. Once you've checked in, Disaster Day committee members will go ahead and direct you to board the bus. This is a map of what Disaster City looks like. I want to bring your attention to a couple of key sites on this map. The first is the red circle, which is the extraction site. That is where the disaster site has occurred. Not every patient will be located there, but please keep in mind that Disaster Day volunteers will direct you to where you need to go on the day of the simulation. The blue circle is the triage area. This is where patients are assessed by providers and sent to different areas of the hospital based on their severity of their issues. The yellow box is the theater. The purple box is the field hospital, and the pink box is the moulage hut. This is where you will be getting any moulage that's required or makeup that's required based on your case. That's where it will be done. So here's just a couple of things to keep in mind before you come to Disaster Day. Please complete the corresponding quiz that goes with this training and make 100%. Fill out and bring the signed waiver. You don't need to complete the modules at this time. If you have any questions, please contact any of the following: Dr. Zumanik, Brittany McCoon, who is our training director, myself, or Chinello, who is our Event Day Logistics Committee Chair. Thank you so much for listening, and we hope to see you at Disaster Day.